Good morning. My name is Joon from Gangnam Sacred Heart Hospital in Seoul, Korea. This is about the machine OQAS, Optical Quality Analysis System, as utility for detecting macular disease. OQAS is a machine that can measure visual quality by detecting ocular scatter and aberration using double pass method. OSI is calculated, and objective scattering index, it's the value that if it is go higher, ocular scattering is more, it's occurring. So because of these principles of the OQAS, it usually used in the condition of cataract or dry eye syndrome. However, in this study, we used this machine to assess the macular disease and with the aim of obtaining new reference data to assist clinical diagnosis. This is method. Patients with macular disease performed the OQAS prior to intravitreal anti-VEGF injection. 88 eyes were enrolled. 43 eyes of dry eye patients were enrolled as control. We compared 6 parameters of OQAS values, and the OCT was performed in macular disease, so we analyzed correlation between central retinal thickness and optical quality. Analysis of ROC curve was done to see which parameter have the most discriminative power to distinguish macular disease and control. This is the result of comparison of 6 parameters in disease, between disease and control. OSI shows higher value in macular disease. MTF stress ratio shows lower, which all means optical quality is worse in macular disease. Visual acuity at 20 and 10% of contrast show worse in macular disease. Correlation graphs show optical quality got worse when central retinal thickness went thicker. This is ROC curves of 6 parameters. Most area under curve of most parameters show 0.6, while OSI is showing 0.772, and at the value of 2.2, sensitivity is 67% and specificity is 76%. In conclusion, optical quality in macular disease is significantly worse than that in control. OQAS may be a useful tool for checking the presence of macular disease. Among all the parameters, OSI is the value that can be the most effective parameter for discriminating disease and control. Thank you.
Could you tell us for which patients or for which setting would you recommend this device?
Actually, I don't recommend yet in macular disease because its principles and it's a bit debating, so not yet. Yeah, I think.
And how long does the examination take? How long does it take? Like OCT is, I don't know, 10 seconds, and this.
Oh right. Oh, the time it's very fast, like several seconds. Yeah.
And another question would be: does it give us any additional information to OCT, or it's just comparable to OCT?
It informs just optical qualities of the imaging, scattering imaging, and the objective image that patients see. So I think that's quite informative. Maybe yeah.
Can I ask a question? So I'm assuming the anterior segment portion of the patients were similar to controls,
yes.
And the scatter quality that is being assessed here, the OSI, is between the surface of the retina and the photoreceptors, correct?
Yes.
So would it make a difference, you think, if there was subretinal fluid alone versus cystoid macular edema versus both?
I think both. It's macular edema itself maybe affect the ocular scatter and things. Yeah.
Okay. Thank you.
Thank you.
Thank you.
One more question from the audience.
Thank you very much for your presentation, Ivan Tane from Bulgaria. I also play with the OCAS, and the main comment on that is that discriminate the signal from the reflecting signal from the diseased retina. So that's not an anatomical compartment, that's a functional. If you got a very good signal from OCAS, that's clearly mean that the media it's okay. But if you got the differences in visual acuity, so that's a macular problem. So that's the main point. Look for the signal. If the signal it's okay for the media, and you have something on the retina. So that's it.
Okay, thank you. Yeah.